Well, welcome. Thank you for coming. As always, this is our effort to keep the people of our state informed on what we know, and we will do that today. Holly May is with us, signing, along with Larissa Martin. We're delighted to have you here. Chaplain Dart, will you please?
Thank you, Governor. Let us pray together. Our Father and our God, we're so thankful for another day, a day when we can trust you and believe that you're able to do anything but fail. Today we pray right now in the name of Jesus that you will give us what we need in the midst of this pandemic, even in the midst of this uprising in cases throughout our state and our country. We know, God, that you're able to do anything but fail. So right now, we give you glory in advance for who you are and what you're able to do, allowing us to choose this day who we're going to serve and believe in. Thank you for relieving us of this disease, even in the midst of us trusting you. You will, you can, and you have already delivered. So we say thank you in advance in your name. Amen.
Amen. And Dr. Linda Bell, DHEC, please, ma'am.
Thank you, Governor. Good afternoon. Today we're announcing 1,497 new confirmed cases of COVID-19 in South Carolina, and 24 additional confirmed deaths were reported to us. This is the highest number of deaths that have been reported to us in a single day. And in addition, 1,160 people are currently hospitalized because of COVID-19 infections. That's also a record high. With cases continuing at this level daily, 1,000 cases one day after the next and after the next, this is severely hampering our ability to conduct contact tracing for cases. It's a significant challenge to interview 1,000 patients each day, and if we think about an average of 3 contacts per case, that leaves us with having to interview approximately 4,000 people every single day. And this it's not a means to control disease anymore if we are unable to contain cases around individual case reports. It's not very effective when, well, actually it is very effective to conduct contact tracing when there are a relatively small number of cases. We call that containment because we can contain spread around individual cases. But when there's widespread community transmission, contact tracing is less effective in preventing spread. And at that point, the work that's needed to combat disease spread is at the population level, is at the community level. It's not at the individual level. And this means that focusing on group settings becomes our priority for contact tracing. In institutions where people congregate, such as nursing homes or correctional facilities, certain businesses or other facilities, and the intent is to prevent local outbreaks within those facilities rather than containment around individual cases throughout the entire population. So we must get these escalating numbers under much better control. And to do that, each of us must make an intentional effort. An unselfish decision on each of our parts is needed to protect others from this virus by wearing masks and through social distancing. And as we celebrate our nation's birthday this weekend, it's a time for us to remember all of those who have sacrificed before us. And in a way, this pandemic is challenging each of us to consider our duty to one another. It's a duty that requires us to look out for the well-being of others, despite the inconvenience and the sacrifice that's being asked of us all. And if we don't take that action now, if we don't social distance, if we don't wear our masks, then we're going to see more of our friends, our family members, our loved ones who will continue to become ill, who will be hospitalized, and many will die. It's important to note that South Carolina's disease cases first began to rise in May, in the days following the long Memorial Day weekend, and they have increased since that time. So considering that as we move into the 4th of July weekend, this is a particular concern. If we're not careful about how we move about during this upcoming holiday weekend, and as we congregate over this holiday weekend, we could see cases rise to the levels that none of us could have previously imagined. This is a public health crisis. And we have too few measures to prevent this deadly virus, so we have to use those very few measures that we have. This includes taking action at the local level. Several local governments in the state have begun requiring face masks for anyone in public. And as the state's public health agency, we support these local leaders' initiatives that are centered on protecting the health and well-being of the communities. And we hope that businesses and all others will also adopt these initiatives, and we support these even when requirements have not been put in place. Remember that this is a virus that can be spread by infected people simply by breathing. That makes it very, very difficult to control. And unless we do something dramatically different to control this disease that is spread simply by breathing from infected people, then we will be looking at projections that are far worse than what we're experiencing now. So please, everyone, take responsibility. Wear a mask around others. Physically distance yourself from others by 6 feet. Avoid group gatherings and wash your hands and practice good hygiene frequently to protect yourselves. We must work together to protect this threat to all of us. Thank you.
Thank you, Dr. Bell. Also, we have with us Marshall Taylor, who's Acting Director of DHEC, General Van McCarty of the South Carolina National Guard, and Kim Stinson, who's in charge of the Director of the Emergency Management Division. Again, thank all of you for being here. The good news in all of this is South Carolina is a great state, a great place. Tourism, people want to come here. The bad news, as Dr. Bell is saying, is the rates of going up, the infection, not only because we're testing a lot more, and we're breaking records in testing. I think we had 170,000, which is a lot. We're doing a whole lot of testing, but we're also getting a lot of positives, and the percentage of positives is steadily increasing. And so that's the bad news. But the good news is we know how to stop that. As Dr. Bell said, this is a disease that is spread by breathing. You remember at the beginning, we were confident that the disease was spread through droplets from sneezing and coughing and touching. All that is still true, but as we've gone along with the disease, as we've studied it, we've discovered that it is even easier than that to spread it. Everybody breathes. Everybody in this room is breathing. Everybody inhales, everybody exhales. If you have that disease in your lungs and you're too close to someone or close enough for an extended period of just a few minutes of time, then if they're breathing in what you're breathing out, then they may get infected. And there you go. And if they are old enough, if they have underlying conditions that have weakened their systems already, and sometimes even if they're younger, but particularly the older generation, then they're in dire straits right there. So that's what we're up against. But the good news is we know that, and we know how to prevent it. There was a song back in the 60s by a group called The Loving Spoonful. Some of y'all will remember it. It said, the name of the song was, Did You Ever Have to Make Up Your Mind? Did you ever have to make up? Did anybody remember that song? Okay, there you go. Well, it's time for us to make up our minds. July the 4th is coming. Everybody wants to get out, but it is a dangerous opportunity for us to spread this virus. Now, we can't be everywhere. Law enforcement can't be everywhere. Law enforcement has got a lot to do. We don't have enough law enforcement officers to handle the usual occurrences that we have going on in the state. We're going to be all over the highways, the highway patrol. Law enforcement is on alert, of course. They're always busy. We don't have enough. We do not have enough enforcement mechanisms to go out and make sure that everybody is doing what they're supposed to be doing. But the people in this state are everywhere. And I would urge you to remember, all of us, that we have a voice. You have the opportunity to invest invest in some common sense with your friends and neighbors and remind them of what it is necessary for them to do. We cannot be everywhere, but I'll remind you of this. If these numbers keep going up, if they keep spiking, if they get even worse, and as Dr. Bell said, I'm sure Mr. Taylor would agree, and everyone listening to this right now, who would have ever imagined that we'd be having over 1,000 positives every day? It just was unimaginable when we began, but here we are. Well, in the executive order, the state of emergency that I issued some time ago, and have renewed certain provisions, we've lessened some, removed some restrictions, but there's some that are still there. And those involving spectator sports, movie theaters, concerts, performing arts, racetracks, nightclubs, and ladies and gentlemen, that includes high school football, college football, all of those kind of things, concerts, those kind of performances. That is what is in the balance, because I will not remove those restrictions. I will not lift those restrictions. I cannot lift those restrictions, those prohibitions, if these numbers continue to rise and the danger persists. I can't do it. I won't do it. It would not be responsible. And under the authority vested in me, I have clearly the authority to do that. There's some other areas, the Constitution's involved, and I urge cities, I urge the municipalities. There are 271 of them in South Carolina. A handful have issued certain mask rules, distance rules, and they've applied penalties. I encourage them. They know their local situation. They know their local customers. They know their people. They know the business establishments, the types they have, the types they don't have. A careful consideration of restrictions is entirely appropriate at that local level. One size does not fit all, but we have 271 local jurisdictions that can take action if they see fit. But even if they don't, even if they do, even if they don't, I urge every South Carolinian to remember that if these numbers continue to rise, if we continue to see this kind of danger going across our state, I will have no choice, we will have no choice, but to keep these restrictions on crowds and gatherings in place. And that means this fall will not be like other falls. We will not be able to have college football. We'll not be able to have high school football. We won't be able to have those kind of sports. We won't be able to have concerts, performing arts. We just won't be able to do it. So I urge everyone, it is time to make up our mind. This is the 4th of July. We want to celebrate this 4th of July, and we want to celebrate the next one too. We want the people that are here today to be here then. And I want to remind I've heard some folks say, well, I'm not going to get caught. I'm going to go ahead and have this event that as of this time is prohibited. Well, the law enforcement may not be there at the moment that event takes place. They might not be there. They might not know about it. They might know about it and not be able to come and mention it or do anything about it. But it is a crime to violate this order. It is a crime to violate this order. And the statute of limitations on criminal prosecution in South Carolina is infinite. That is, it could be a year from now, it could be a month from now before someone is held accountable for what they do this weekend. And also, you have civil responsibility. I would urge everyone with an establishment who is going against the CDC guidelines to remember, not only remember your neighbors and how important this is, but remember your own responsibility. If someone with an establishment goes against these guidelines and someone goes there and they become ill because they went to that event, they went to that place, went to your business, and there were no precautions under the CDC rules and guidelines and those that we've been expressing here for months now, and someone gets sick and dies, and they can show to the ladies and gentlemen of a jury that it is because they were at your place, then there will be an enormous price to pay. I would hate to be the one to try to explain to a jury of your and my peers that I, in opening up my establishment, whether it is in the daytime or the nighttime for any age, and allowed people to come in and to congregate and to be close and to violate all the rules, and I allowed that to happen in my place, and someone were to get sick and die, and they can prove it, that that's where it came from. You can eliminate to other places. I would not like to be the one trying to explain to the ladies and gentlemen of the jury why I allowed that to happen. We don't want to get into that sort of thing. We don't want these death figures, these high infection rates, they're frightening. But we're better than that in this state. But we've got a test coming up. A lot of the young people just don't think that the younger generation, maybe a couple of generations, just don't think that it's going to happen to them. Well, they're young and strong, and as many in this room are, and chances are the disease will go right through them. They may feel a little ill, maybe not even feel it at all. But anyone that they come into contact with while they're carrying that disease, while they're breathing, while they're perhaps coughing, sneezing, or maybe just breathing in close contact, that is in an older generation or somehow is weakened, then that person is going to get that disease. And so we've got to be very, very careful. 4th of July is a time when we celebrate, but we have to, and we're going to celebrate. This is a great country, for goodness sakes. The 4th of July is a wonderful celebration. What it signifies is unique in the world, the history for this great country. But again, I can't say it often enough or strongly enough, we have got to be careful. And if we want to go into the fall with the schools opening, with football games and all of the things that go along with that, all the kind of celebrations and concerts and gatherings, we must control the spread of this virus. So I ask and I urge everyone to take this thing seriously. And if we do that, if everybody does that, then we'll be in good shape. If there are many of us who do not do that, then we will not be in good shape. And what's usually a great celebration with spectator sports and concerts and those things will be very quiet time in South Carolina. So, with that, we'll be glad to answer questions. Yes, ma'am.
Governor, why not take make additional restrictions now that we are seeing a spike? For example, beaches this weekend. Any plans to close them since we've seen a lot of crowding?
The local authorities have the means at their disposal, as you can see from various ordinances, and only a few have passed ordinances recently, but some of them a little bit the same, but mostly there are a lot of differences. They have it within their authority to do certain things, and they ought to consider those, and they ought to do it. Be sure don't go over the line of what would be a violation of someone's constitutional rights. But this is a serious disease, a serious health hazard, and they do have those kind of responsibilities. But we cannot enforce all that. We can pass, if passing a law with a stiff criminal penalty stopped crime, we wouldn't have any crime in the state. Wouldn't be a soul in the jails. But passing a law, having a resolution, it may help, but it does not stop it. And we cannot enforce this. This is too big. This is all across the state. Every local jurisdiction is a little bit different. So I urge all the local authorities to do what you can, get the message out, take the steps you think are necessary. Be careful. Don't go overboard, but be careful. But the responsibility lies not with someone on stopping you, but on you stopping you. That's the whole point. This is something that unlike anything we've seen before. Yes, sir.
Governor, DHEC yesterday urged people to have at-home festivities to celebrate the holiday. Do you agree with that assessment? Should people stay home this weekend?
I think it's great. Those that would like to stay home and want to make that decision, that is a good decision. But if you don't want to stay home, if you want to go out, everybody knows what they ought to do and what they ought not do, and that's what they need to do. It's real simple. There's no mystery in this at all anymore.
Also, Lexington County Blowfish, we're apparently selling tickets for a game this evening, the start of our 30-game schedule. do you support them playing or even playing a game with or without fans in the stands? And should they cancel tonight's game?
Well, spectator sports are not allowed under the existing executive order. And I would say again, those who violate those existing executive orders, those lawful orders, there will be consequences of some kind.
What's the penalty?
Big part.
What's the penalty for operating when you're not allowed to?
It depends. Typically, it's 30 days, or I think $100 in jail. Or you also have again the civil consequences that I mentioned earlier. That may be a little time in getting here, but will arrive under the right circumstances, or I'd say under the wrong circumstances. We got to be careful. Yes, sir.
Governor, what are your thoughts about the the suspected coronavirus clusters that have come from Myrtle Beach into West Virginia, and some of the things that the governor there has said about travel to South Carolina?
Well, we had said the same thing when the CDC, the Center for Disease Control in Atlanta, issued a domestic travel advisory for New York, New Jersey, Connecticut, and the city of New Orleans. We responded by requiring people from those places to quarantine, and also we didn't accept reservations in hotels. I think every state is doing that. There are a number of states that have fallen into the category of the kind of disease rates, contagion rates that a number of other states are referring to. There's nothing wrong with that. I mean, they ought to be. Everybody's being careful. Yes, in the back.
Dr. Bell, this is a question about the death rate. Are you concerned at all about the death rate? We've been hearing from people who are saying, hey, we're not as alarmed about it because, or we're not taking as many precautions because the death rate isn't as alarming.
I'm very concerned about the death rate. Any one death is too many. Maybe people are thinking about the death rate is not going up as quickly as the disease activity rates are, but they are now beginning to creep up. So the more people who become infected, you can expect that hospitalizations will increase and that deaths will increase, and those can be preventable. So yes, I'm very concerned about each and every death that's reported to us.
Dr. Bell, where are you guys at with contact tracers and volunteers? Are you looking for more? Is it too overwhelming at this point, as you mentioned, to track around 4,000 people a day?
Well, yes, so that our priority for contact tracing, we will continue as best we can to notify each case that's reported to us as quickly as we can, and to try and notify the close contacts. Many people don't want to be notified. That makes that more challenging. But as cases increase, we have to prioritize on settings where the risk is higher. So as, with workforce limitations and things like that, and the time involved in the thousands and thousands of cases each day, we will focus on healthcare facilities, I should say nursing home facilities, assisted living facilities, those types of congregate facilities where there are vulnerable populations, and any reports of clusters that we see in facilities where disease transmission can occur within a defined population. Those will have to be our priority, because those are settings where we can do containment interventions to prevent disease spread. But once it's at the population level, then again we have to focus on population-based interventions that are much more effective when disease is widespread.
And do you know the percentage of people that are getting back to you guys that you are trying to contact and notify? Do you know that percentage off the top of your head?
No, I don't know off the top of my head.
And Governor, 2 questions for you if you don't mind. Can you explain, you've repeatedly mentioned that it might not be constitutional in order to enact specific statewide ordinance, a lot of the time referring to mask ordinances. Can you explain the constitutionality behind that and your argument for such? Why it would be overreach?
Restrictions on people on their right to assembly, their freedom of religion, for example, we know of that. The freedom of speech, but in this instance, particularly the freedom of assembly. The cases, this is a legal area. Most people don't get involved in this sort of analysis, but legally, you cannot take that away from people unless you got a real good reason. And if you have a good reason and you take it away, what you do must be limited, it must be effective, it must be targeted, it can't be more broad, it must go only to the issue and must be effective against that issue and must not be for 1 second longer than is necessary to effectuate the purpose. So when you try to have a statewide ban on things that restricts people's liberty, each town, each county, they're not the same. The businesses are not the same. The people are different. They have different customs. They have different ways. The stores are different. The institutions are different. So one size is very difficult to fashion a one-size-fits-all for the 271 towns and the 46 counties and the other, I think, about 129 communities in South Carolina, most of which, as you know, they're quite different. But those communities know their own geography and their people and their businesses, and they could do a valid job, I think a defensible job, if they believe that it would work of targeting what they need to target. So that's why I say this is an easier thing to be done at a local level than it is at a statewide level.
But just to follow on that,
and the consequences are, if it's too broad, someone goes out of business or something happens, then those who have issued the prohibition are responsible financially and otherwise.
But and again, just to follow on that, you were saying that this needs to be limited, so in terms of maybe limited time scale, and as well as it needs to be directed, and you need to show public impact. We did shut down businesses statewide, and but couldn't you also make a recommendation or make an order that states and local municipalities would have to come up with their own ordinances in accordance with what their community needs?
That's what we were just talking about. We've gone over these kind of details and this kind of recommendation multiple times from this very place. Some have taken action, others took action prior to that encouragement. But there are others that can do various things, and if they see something that needs to be done, they ought to do it. But again, there's not enough enforcement mechanism, enough police or others to go to enforce this. So it's necessary for every citizen to understand. Don't wait for somebody to come tell you to quit doing it. Just be careful. Follow the rules yourself, and we don't need that. Yes, sir. In the back.
Are you telling local states and local municipalities to enact an ordinance or to do that?
I'm telling them that they know this. I've had conferences with mayors since this began. They have, under home rule, they have authority to do certain things. Health ordinances are within that ambit of authority, but again, it's not unlimited. They must limit it. It must be targeted and limited, as you said. Yes, sir.
So what else can be done in terms of on a state level to get people to wear masks, to social distance? Because it seems as if they can't. They're not listening.
In addition to what we've done, you can't make people do this. The only way to make them do it is to be able to enforce it. But the best way is to give the information to the people, to make them understand, allow them to understand what is at stake, how this disease is spread. And we have discussed that. You can't turn on the television without seeing something about it. And to follow those rules and take care of themselves and help their neighbors as well. Joe?
Governor, the Lexington County Blowfish are arguing that there's a loophole that allows amateur sports to take place. Without stopping fans from...
I don't know what that loophole is. Not aware of a loophole.
Two questions just to clarify that. So under the order that you have issued, would the American Legion baseball games and the Little League baseball games, if they're played in draw crowds, would that violate your order?
If they're what?
If crowds gather at American Legion baseball games or Little League baseball games, would that right now violate the terms of your order? It would. Okay.
Should law enforcement break up these games?
That'd be up to law enforcement. They might be breaking up other criminal activity. As I say, they can't be everywhere. But the citizens themselves need to understand that there's danger involved.
Maybe Dr. Bell can address this. I think you mentioned, Dr. Bell, that the hospitalization rate is at a single-day high. Do you have an idea of what the statewide hospitalization rate is right now, how close we are to capacity again, and what the contingency plan is should the beds become at a premium?
I think the current bed capacity is about 75%, and there are, we do have a breakdown of the percent of those beds that are occupied by people who are COVID-19 infected, and I actually looked at that figure earlier, but we can get that for you. I don't know if Mr. Taylor has that figure.
Dr. Bell, while you're up there, we've seen local mask mandates put in place. How long should we expect to wait to see any kind of effect of those mask ordinances?
The effect of the mask ordinances?
Yeah, like if it's doing anything good.
Well, if they're widely adopted, what we've seen in other communities is really within, it's not just mask use alone. That it also relies on other measures for having practices in place for social distancing in businesses and limiting the number of participants and things like that. But there is published information that within a matter of days, you can look at percentage points and decline in cases within a matter of days. And so within about 5 to 6 days or so, there's a published report about this. I don't have the exact figure. But there's abundant evidence that they do work, and that the decline after the course of a few more days, you see an additional percentage points and drops. And so the longer that they stay in place, those are additive drops in percentage of the population that is ill, who live in communities where they are widely adopted.
Dr. Bell, if there was a statewide mandate on everyone wearing masks, do you believe that it would help prevent the spread of the virus here in the state? Do you think it would be beneficial to have a statewide mandate?
Well, what we've seen in other communities is that there's abundant evidence that those that population-based measures where the use of masks and social distancing are effective, we have seen dramatic decreases in disease activity in other states in the United States and in other countries. So we do know that those are effective, and so public health officials do support those.
And I have a follow-up question. What was the infection rate in March compared to now?
The infection rate. You'll have to, that can mean different things.
I guess if one person is around, spreads it to 2 people. Is it like a 1 to 2 ratio?
Oh, the ability to spread.
Yes.
So back in
March.
That's a difficult question to answer, but we can make estimates that for each case that's infected, they can infect 2 more people. And so for every single case, if you think of 1,000 cases a day, and you don't have to think about that very long, for a few more days, why we will see an escalation, and that's exactly what we're experiencing.
So it's grown from when we first were experiencing cases, or it's about the same?
Well, the reason that's hard to answer is because it also depends on what measures are in place in the community. So you would have to look back at what closures were in place back in March, and so you're looking at different interventions at different points in time, which makes it difficult to make comparisons from one point in time to another, because it's not just dependent on the transmissibility of the virus, it's also dependent on the risk of exposure.
I got a question, a legal question for you. You mentioned at your time there that you were saying that you want people to take individual action when they're addressing a business that potentially could have gotten them sick, even going to the courts of law and bringing that up with
No, I'm not encouraging people to do that. I'm just saying that is a remedy at law. It exists at law, always has. But I'm encouraging everybody to follow the recommendations and be safe, yes. And I'm also, in that vein, the Palmetto priority that we have instituted, where it is a statewide effort by the Parks, Recreation, Tourism, DHEC, and the Retail, Restaurant, and Lodging Association. We now have 1,658 restaurants have applied to receive the seal, and also in Greenville, Columbia, and Charleston, and maybe other places, they have a similar citywide program. And I would urge people, if you don't see that seal on the door, if the program has had time to be in full operation and people to get the seals, if you don't see that sign on the door, don't go in. I'm not going to go in. Now, there's no law requiring that, but self-preservation and common sense require it, and that's what I'm going to do, and that's what I'd urge everyone to do.
And on what you're saying with it being the 4th of July and that coming concern that you and both Dr. Bell have mentioned, are you saying that people should still be able to gather in large crowds? DHEC's recommendation being very clear that people should be staying at home if possible, or watching fireworks or any other displays.
No, we're saying the same thing.
vehicles.
We're not encouraging people to get in crowds, certainly not, because that's dangerous. So no, we're not encouraging, we're discouraging that. And that's precisely the reason we still have the executive order that disallows, prohibits these things: spectator sports, movie theaters, concerts, performing arts, racetracks, nightclubs, all those sorts of things. Those are crowds. That's where people get together, and those are prohibited by law.
The president will actually be hosting a crowd at Mount.
Sir?
President Donald Trump will actually be hosting a crowd at Mount Rushmore in the coming days for celebrations. Do you endorse that?
You have to ask the president about. I'm not familiar with the president's plans.
Governor.
Yes, ma'am.
Yeah,
You're right.
this question's for Dr. Bell. Are we able to flatten the curve anymore in South Carolina? Are we past that point? I guess what stage of emergency are we at right now? Is it worse still to come, or?
Well, that depends on how people follow the recommendations. So we absolutely can turn the curve around. We could get there more quickly with widespread practices that are recommended. If we had universal use of masks, if businesses supported the recommendations and limited the number of patrons but still remained open but required their employees, their patrons to wear masks. So certainly there's a lot more that we can do that's not being done now that would work, and it has worked in other communities and it can work here, but we really have to make a dramatic difference in what we're currently doing to make those curves turn around. Thank you.
Thank you, everyone.
Thank you.